I'm Linda Duberly and I'm with Mark Britnell, one of the foremost commentators on healthcare systems across the world. He masterminded the largest new hospital build in the history of the NHS and developed one of the highest performing organisations in the UK. As CEO of the NHS's South Central region, he led a significant financial turnaround before taking up the invitation to be Director General of the Department of Health. He was a key driving force behind the high quality care for all, led by Lord Darzi. He's currently Global Chairman of KPMG's healthcare practice, and he joins me now. First of all, can you tell me, why did you write this book?
When I was growing up as a child, we couldn't afford to travel anywhere. I only took my first air flight after I left university at the age of 22. And now, of course, working for KPMG and being the Global Chairman for Health, I've worked in 60 countries on nearly 200 occasions. My passion is healthcare. And basically, I've enjoyed over the last 6 years the opportunity to work with some fantastic people doing great things for patients. And at the beginning of my book, In Search of the Perfect Health System, I start with a quote from St. Augustine that basically says, "The world is a book and he who doesn't travel only reads one page." And so the wonderful irony and symmetry of turning a page, in a sense for me in my life, I was turning a page in terms of looking at other health systems in the world. I hope that my passion for healthcare shines through the book, and it has been a tremendous privilege.
And who do you hope will turn the pages of your book?
Well, I think there are 3 or 4 distinctive audiences. The first one are the clinicians, the doctors, nurses, and also managers that work in healthcare. I think that's the primary audience. The political class, I think, need to read the book because it makes a lot of comments on politicians, their courage or their lack of courage. Patient groups, I think it speaks to my experience of having prostate cancer at the age of 42. I talk about that, but also how the future's about patients becoming more empowered. And also, I think, because I've seen this, there is an explosion of global health courses around the major universities in the world. And so I guess, and I hope that students will also read about it.
What is it about healthcare then that fascinated you when you first joined that sector?
A doctor once said to me in the first week when I started in the National Health Service back in 1989 that all of humanity is in healthcare, and those words have stuck with me, and they're absolutely true.
It's a sector where you believe that you can make a real difference.
Very much so. If you think about what we did in Birmingham, that hospital will stand now probably for a century, and so quite literally millions and millions of people will benefit from that building and that care.